कुर्सी बाप ये हटाइए।
Friends, so welcome to this Thursday Digital IMA webcast. Indian Medical Association Headquarters is doing it in collaboration with Library and IMATV system, and you are able to see us live. Today we have a panel of pediatricians, in fact, on our panel, and Dr. K.K. Agarwal, Secretary General of IMA, will be joining us in a few minutes because he is busy in a central government DGHS meeting. And we have Dr. Ramesh Datta with us. Dr. Ramesh Datta is a senior pediatrician in West Delhi and is currently the Joint Secretary of Indian Medical Association Headquarters also. We will shortly be joined by another pediatrician and a few more persons on the panel. So today main discussion will be National Immunization Program of the government, plus many more added latest or the current immunization programs that are being followed by various pediatricians all over the country. In fact, we will be talking about the latest vaccines available in the market and how they are helpful to our children and to our health. Friends, you know, immunization is a big issue nowadays. Everybody wants to get rid of diseases. Everybody wants to prevent the disease. Nobody wants to fall sick. And over the years, this immunization has saved many children, many lives in the, all over the globe. And it's an important issue for GPs also, because many of the GPs or many of the people are giving vaccinations in our clinics, and some of them are referring to pediatricians also. So even if you are referring to a pediatrician, you should know what are the latest vaccines, when to send a patient, when not to send a patient, what are the indications, what are the contraindications, and what is the basic the program that has been planned by the government and which everybody believes each and every child in the country should have it. 100% immunization coverage should be the goal of the doctors as well as the government. So I think this today's discussion will be enlightened about the basics and the top of the order new vaccines available, because every day you find some new vaccines, some new trends coming up, some new viruses coming up, some new genes coming up. So you have many variety of these vaccines available in the market, and we will be taking them up one by one. In the meantime, I'll ask Dr. Ramesh Datta, how do you feel that the vaccinations have helped our community or the country as such over the last 50 years or so?
When India got independence, there was no national immunization program, and the death rate was exorbitant that time. And gradually, the government of India introduced immunization program at the national level. To start with, they started with BCG, DPT, polio, and measles. Measles came late, but DPT, polio, and BCG was introduced. So that time, the mortality with these diseases came down drastically. Gradually, they introduced measles and MMR, and now they have introduced hepatitis B and typhoid vaccine also in the national immunization program. So with these introduction of these vaccines, the mortality has gone down drastically. Now the mortality is 1/4 or 1/5 of what it used to be 50 years back.
That's a great, I think that's a great achievement of our medical system in the country. Now I'll request Dr. Datta to tell us one by one what all vaccines are there and what time should be given and what are their contraindications also. So we can start with polio vaccine. And
Yeah.
you know that I think that's the paramount thing, and we are really, I mean, privileged to see that this is no more a disease in the country.
Yeah.
But definitely all precautions have to be taken.
Yes, yes. So, to start with, when the child is born, it is visible to give polio, zero polio vaccine, oral vaccine, and hepatitis B vaccine within 24 hours of the birth. You know, that helps the child to get protected from polio as well as hepatitis B. If the carrier state is there, it helps him to get rid of hepatitis B disease. Then BCG, now there is a, earlier BCG was given at the time of birth, but
Yeah.
now there are instructions, now you can say, the guidelines are there that it can be given within 1 month of the birth. Then from the hepatitis B is given at 4 months, 4 weeks, then 10 weeks and 14 weeks. So 3 doses are given. This is one schedule. The other schedule is at 4 weeks and then 6 months. 0, 4 and 6 months. Then DPT comes DPT. Diphtheria, pertussis and tetanus. It is given 3 doses of this vaccine are given at 6 weeks of age, then 10 weeks and 10 weeks and 14 weeks of age, along with oral polio vaccine. And now in some states that hepatitis B vaccine has been introduced and it is given jointly, in a single injection.
Yes.
Like Delhi, it is now this pentavalent vaccine they are giving, single dose. So then there is the DPT at national level. It is given at cellular level. Acellular vaccines almost have been withdrawn, which was given that it causes less pain and fever. But it has been seen that after introduction of acellular vaccine, the incidence of pertussis has gone up.
Achha.
So Government of India is now discouraging to use acellular vaccine, which was very costly and it was not affordable by common people. Since its inception, Government of India is advocating that cellular vaccine, because pertussis cellular vaccine causes mild fever. That mild fever is tolerable than having a child pertussis, which is a very serious disease. And it causes lot of problems to the child.
We are joined by Dr. Ajay Gambhir. We just started. We were talking about the basic immunization, that the government is advising us. We have talked about polio, DPT, measles, and BCG that has to be done. And let me introduce Dr. Gambhir. Is a very senior pediatrician in Rohini area. In fact, he is a renowned pediatrician and neonatologist all over the country. And he has been the president of Neonatology Forum. And currently he is taken as a real senior person as far as immunization and neonatology care is concerned. So we will continue with that with you. And what you were talking about, typhoid is also a part of the national immunization program currently.
Currently, after 2 years of age, the Government of India is advocating, and in some states it has been mandatory, and some states yet to take up. But I think the Government of India has advised that typhoid vaccine should be given at the age of 2 years to all children.
So what are the guidelines with IAP that you agree with the government schedule on all these immunizations, or you feel that that is inadequate and many more things have to be added, or what are your latest instructions to your doctors?
Thank you, Dr. Munga. The government under the universal immunization program has added some immunization which cause high mortality. So definitely the government priority is on the mortality, not on the morbidity. So the mortality, diphtheria, pertussis and tetanus are very, very important because of, not because of the tetanus of the child, but tetanus of the mother and the newborn. And later on the measles, which is one of the still the major cause of death and mortality and morbidity in India. But as the country is growing and our child mortality is reducing, and especially in the area, in the developing economy, the people are thinking of the quality. So there are a lot of new vaccines which have been added worldwide, not only in the developed countries but in the developing countries also. So those were, for example, HIP. Government of India was one of the last countries to add HIP. We added very, very late. In fact, some of the poorest country added much earlier than that. Because HIP causes a lot of respiratory problems and also meningitis. Now, Government of India is thinking of, so they have already added in pentavalent vaccine. Now, Government of India is thinking of adding a vaccine in polio, because polio has been done oral polio, and as per as the international experiences, the oral, if we give oral polio beyond a point, some of the complications start. I think something like VAP, vaccine associated paralytic polio, or some derangement or having of some genetically reformed viruses which will cause more problem. So it has been recommended to give injectable polio, 1 dose of injectable polio, which was also a recommendation, but it is 1 dose, not 3 dose. So the message is 3 doses of oral polio are must. You should not avoid oral polio. Add 1 dose of injectable polio along with oral polio. That is good enough.
But they are saying that it will not be available, oral polio will not be given after April or something like that.
No, it's not that. It is because whatever polio we are getting, it was trivalent polio.
Yes.
So it was a trivalent polio which is going to be changed according to the need of the country. It will be bivalent polio. So depending upon the concentration and need, and it will be after the April, it will be bivalent polio, and it will be availability of the injectable. Now the question is, the injectable polio is yet not available in India. That is why the best policy is sequential oral and then injectable slowly.
Okay.
Though some of the schedules worldwide are recommending only injectable, but for the sake of the country and national policies to give oral polio with add-on to injectable. So message should be taken very, very clear that oral polio should not be stopped. Some of the companies or some of the information which is given in the media or vaccination companies are to give injectable polio, it is good enough. No, oral polio is in the need of the country, and that is why we have gone on bivalent. So bivalent add with injectable polio. Minimum single dose, preferably 2 doses.
Good. Friends, we are joined by Dr. R.N. Tandon. You know him, he's a very senior officer in IMA headquarters. He is a finance secretary also. He is a surgeon by profession in the heart of the city. And in fact, if you have any problem or you want anything to be answered by this panel, you can take our phone number, that is 9810118256. You can SMS your questions, and these friends will be able to guide you better on these programs, whatever questions you have. As Dr. Gambhir, we were talking about the national universal coverage, in fact, universal coverage. What about these vaccines, like, they're very old vaccines like MMR vaccine and typhoid vaccines in the market? They are a part of the program, or they are additional vaccines which are to be given?
I think this is a very relevant question. The measles coverage in India was poor. So the epidemiological and the data, because remember, vaccines are drugs and vaccines are biological drugs. They are not drugs like any other drug that which will go out of your body from the stool and urine. So it was seen that the coverage of measles was poor, and some of the places we started giving the MMR or second dose of the measles. So now the government of India has recommended that measles at 9 months, one dose, and MMR, another dose by 15 months will help the child in a better way. So,
We are joined by Dr. K.K. Agrawal, your old friend, your senior colleague, and Secretary General of IMA. He was busy in a meeting in Central Government Health Ministry, so he joined us now.
The meeting, let me brief about the meeting. According to international regulations, we need to phase out mercury by 2020. And IMA has taken a stand, why wait for 2020? At least we, the medical professionals, members of Indian Medical Association, we can at least phase out mercury thermometer and mercury based PP instruments by 27th of December this year. You will get more information. Please carry on.
Yes, Dr. Gambhir, you were talking about MMR.
so it is in the part of the national program. Now the coverage, where the coverage of measles states have increased by 60% to 80%, the dose of MMR is allowed.
Okay.
So MMR is part of the national program. Typhoid was started, but however it was non-availability and effectiveness and efficacy of vaccine was not there. Hence it was not promoted. Delhi was the first state in India to start mandatory typhoid vaccine free of cost. However, it did not show result, so practically it was discontinued. Now we have a new vaccines which is available in India, and that will be helpful. So we are recommending typhoid not at 2 years, 1.5 years, 6 months, but it is still not a part of national program.
What do you mean by national program? We are an IMA. At an IMA, either we recommend or we don't recommend. So because we are basically also representing the private doctors. So if I am going to tell as an IMA, only follow the national program, that will not be correct. So people who can afford. So my definition will be national program plus people who can afford. This is what IMA recommendation is.
No, I think
so
IMA,
what can be the IMA policy on typhoid?
I think this is a very relevant question you have raised. Being a very the body representing the doctors and in the interest of the public, we have to make a policies, see the epidemiological data. What the government tried only for mortality. Before you came, I told government criteria was mortality. कितने लोग मरे, कितने लोग बचे, they were not interested. Now we are interested in quality also. कितने बचे उसके भी करें. Some of the vaccines were not good vaccines. Polysaccharide vaccines were not good vaccines. And now the new technology has come, conjugate vaccines. So because of technology, India has become the hub center of production. Hyderabad is one of those centers in the world which exports the vaccine, and Pune. And definitely it has to come. But the rider is, we have seen lot of backlash from the vaccine like chickenpox, which is supposed to be not very good vaccine. The new strains are coming. That there is a herd that if you cover 70% of the population only, then vaccine is effective in that. If you coverage is only 10%, it is not effective. It is not an individual vaccine. So rider is that typhoid with clean water supplies, hand washing is must to control the typhoid. Typhoid vaccine alone is not helpful to control the vaccine, to control the typhoid disease. So
No,
these vaccines have to be covered.
I get it. I'm not denying that. I said I need a couple of you people who are experts to come out with the IMA stand on typhoid.
Yes.
Okay. Suppose we say that people who can afford. I may say because this is not a part of national program.
Yes.
Therefore, those people who can afford, our practitioners who are members of Indian Medical Associations are advised to give the following typhoid vaccine for conjugated technology, and this is the duration, this is the protocol, and for which IMA has also put out a tender in the market and negotiated a rate. These are the suppliers available at a IMA negotiated rate, which may be 30, 40, 60, 70% cheaper than the market.
Right.
We can produce that.
This is known as advanced contracting. This is a very good move.
And we just have to put it under that this rate will be applicable to IMA, and along with that, IMA says typhoid alone will not work. Therefore, IMA safe water or safe hand technique needs to be complemented with that. Therefore, our members are advised to, whenever they are putting a typhoid vaccine, they along with that they issue a poster which is IMA poster on hand hygiene.
Personal
They give it to
hygiene
the patient, give it to the patient along with the typhoid vaccine.
I think
Now
this.
that will be a proactive step of IMA.
Yes.
Then only to support the
So
government.
yes, it will be disease control and elimination not only by vaccine alone, it is disease prevention. And it was known as neglected disease initiative because typhoid is not a disease of Western country. Most of the vaccines were being produced, developed and researched in the Western country, and it is a waterborne disease.
So,
It is all
help
poor.
us.
So India has to take a lead. So government of India has taken a lead of the typhoid and the dengue vaccine, which is a neglected disease, which is a not disease of the foreign countries. So we have to definitely put
Agree.
some data.
Help us out in coming out with the IMA typhoid policy. Plus help us in designing a poster
Okay.
which becomes compulsory. That when
Yes,
you
yes.
give a typhoid
Yeah,
vaccine,
definitely.
along with that you print out a poster from the website of IMA and give it to the patient. And that becomes the IMA step.
Good.
Similarly, apart from typhoid, is there any other vaccine out of the National Conventional Program? So there are similar schemes can be brought forward. One is typhoid.
The other program which government of India is launching is planning is adding the rotavirus.
Rotavirus.
Because rotavirus being supported by Bill Gates and now India is producing this indigenous vaccine. From $10 we are producing $1 and government of India is planning to roll out in mid-year to give the rota. They are like drops, they are a oral thing, so it can be taken by a thing and it will reduce rotavirus diarrhea and reduce the admission and the death due to diarrhea. So the IMA has been the leader and champions of in vaccine preventable diseases including polio program and also letting people educate on hygiene and also the adverse even and educating on the vaccine related problem. For example, polio again, when you take polio it transmits from my stool. So I have to take care that if there is some immunocompromised patient in my house, so the oral polio has to be taken very safely. So I have to educate now. So IMA can take lead role in that. And advanced contracting.
Again, rotavirus. More details.
Okay.
Rotavirus will be available through the government.
Is in private is available in 1,000 rupees. Now through the government it will be available free of the cost, which it will cost around
65, 70.
65 to 70 rupees, which the government is going to fund. So they are taking 10 districts to start with.
No, I'm talking when it is costing 65 rupees to the government. Why shouldn't it cost 65 rupees to IMA?
Yes, we can definitely.
I'm talking about IMA. I'm not talking about individual doctor. If I negotiate a rate for the private sector,
Yes.
and I tell the company that I want to buy 1 lakh vials, and before I give an order to the company, I negotiate for 1 lakh vials, then I send general members to all members, kindly immediately put your orders to the company. And if 1 lakh vials have been ordered, your rate gets fixed.
Yeah, I think this can definitely.
There is another question on rotavirus by Dr. B.K. Jain from Kakinada. He says, which rotavirus vaccine out of available brands is recommended? And PCV vaccine, what is it? PCV vaccine, is it a must for a child? Which brand is advised?
We're talking about pneumococcal, but let's talk about rotavirus. Rotavirus, you are saying, is available in the market.
Is available in
It
the
is available
market.
at 1,000 rupees.
Yeah.
This is imported.
This is all important.
Indigenous one is not available.
Indigenous one is now available.
At what rate?
At same rate.
What 600 rupees?
Well, approximately same rate. But
But why government gets a 65 and we are getting a 1,000?
now that is a marketing strategy. Definitely the NGOs and civil society like us have to chip in the interest of the doctors and the patient. Because government will get in the cheap rate because of the advanced contracting and advanced things. Because if they buy 10 million doses, maybe the company will produce that much and they have that capacity and they will upscale their capacity and they will have that much of staffing. So definitely.
Okay, what is the protocol for rotavirus? What
The-
age?
Rotavirus
6 weeks
to start from the 6 weeks, it will can go up to 6 months.
8 months.
Yes,
Okay.
maximum up to 8 months.
Maximum 8 months.
But we want to avoid after 6 months because of there are some cases reported of the interceptions and all that, but they are minor.
So this has to be given before 6 months.
6 months.
That
That's
means
it.
it is not going to be given to people who are 2 year, 3 year, 4 years.
No, not at all.
So only 6 weeks to 6 months, single dose.
Maximum
Yes,
8
two doses.
Two doses.
Pentavalent 3 doses.
So different strains are there. He's right. So the question is
Pentavalent 3 doses, 2 to 3 doses, depending on the.
yeah, strains.
Now, are you recommending it to your patients?
Yes, we are recommending with the patient with the education that it does not control any other diarrheas. It only what happens, sometimes patient takes, he thinks that I am safe from everything. Again, he is safe only from rotavirus diarrhea, which is a serious diarrhea. He is not safe from any other infective diarrhea or any other viral diarrhea. Hand hygiene and other maintenance has to be kept. We are definitely recommending.
Okay, so we have typhoid, we have rotavirus. Any other virus which is coming? Yes, explain again chickenpox again.
In between, just on the rotavirus. I mean, what is the percentage of diarrheas being caused by rotavirus?
Yes.
In Delhi.
It is rotavirus diarrheas. In OPD we are not bothered. The surveillance which is available from India, 8 central centers have been made by Indian Council of Medical Research. 18 to 40% of the any hospital admission is rotavirus.
That
Up
means
to
indirectly
40%.
rotavirus is causing more serious kind of a diarrhea.
Diarrhea.
In that way, you can say.
And there is no treatment available. Only thing is you have to rehydrate the patient. But it is preventive. Though the efficacy of the vaccine is still reported to be 40%, but this is the first batch of the vaccine. Maybe in further we have a more protection. The protection is not very good. So definitely I'll say.
I take it other way around, because if we always say to public, because if I am going to say it is going to be only 40%, they will not take it. So I say it will prevent rotavirus. If not, it will reduce its severity.
Severe. Is that
Severity,
correct?
yes.
Otherwise what will happen is the whole program will fail.
Yeah.
If we are going to talk about that, we always say in adult vaccination for pneumonia, flu everywhere, we say it is not, it may not protect you from flu, but it will not,
It will reduce the.
it will reduce the complications rate.
Severity.
Definitely.
The severity will become low. So if it, and even if a person becomes severe, our answer will be otherwise you would have died.
Yeah.
Now there are issues of acceptability are coming, and the question asked by our doctors about the which strains. All strains are good. Some will have 30% protection to 50% protection, but definitely we feel that strain which is easier to take, less cost, which is cost effective, should be promoted. So it is your take whether you give 2 doses or 3 doses. Today we will not ask about
Come
any.
back to chickenpox.
Yeah.
Okay, we are talking about both
Yeah.
shingles as well as chickenpox.
Okay.
Adult
Yes.
shingles and here are chickenpox.
Yes.
Are we? What is the IMA stand? Should be the IMA stand? Means your recommendation for the IMA stand, where we can come out with a policy. IMA stand on chickenpox.
Chickenpox is an important disease because it does not cause mortality most of the time, or I say generally it does not cause mortality. And there is a fear in the girls that it causes marks. It does not cause marks. Moreover, chickenpox is more on the body, not on the face. It is, the distribution is not like smallpox. But it is seen that if the mother gets the chickenpox, the child will get it, especially during the time of labor or after the delivery. So we should protect the children from the chickenpox because it causes problem in the adult. This goes as a herpes, if your herpes is a herpes virus. The chickenpox is protected from the mother breast milk. So in India, we were initially giving chickenpox around 2 years. Then later on, the age was reduced to 1.5 years and 1 year. We have seen if you give at 1 year, there is a chance of breakthrough that it comes back again. So IMA stand should be give chickenpox after 1.5 years, not before 1.5 years. Now, the vaccine which is available from the Oka strain, original Japanese strain, and the other strains are available, are not very effective vaccine if you give before 1.5 years. New vaccines, which is a Chinese vaccine now world over recognized, is going to be available in India soon. Its protection rate is much better, and efficacy and effectiveness both are much better than the present vaccines. So 1.5 to 2 years, because if chickenpox is there in a child, it is not very harmful, but it definitely enters in my body, stays in my body. So we want it should not occur. Adult virus vaccines are not available in India. definitely we are working that they should be available in India too for the adults because
So as on today, you're saying is, your recommendation for the IMA sand is that chickenpox, yes, for people who can afford, because this is not a part of national policy.
yeah.
It may not be reimbursable under the national policy, under CGHS and other things. You know, person will have to buy out your own pocket, and it should be given between 1.5 years to 2 years.
No, and the booster dose also, between 4 to 6 years.
Yeah.
Chickenpox.
Booster dose.
Initially we were giving one dose, we have
One
seen
dose,
lot of breakthrough because again, it is a population, it is a virus. I am pushing the virus in my body, it comes out of my respiratory system and other things. We have not understood lot of things about the viruses. How they get excreted, they are biological products. Vaccine is a biological product. If I take it, it affects you also. So we have seen there is a high chances of chickenpox. As the child goes into the school, they are get exposed to the flu virus and to the chickenpox virus. So that is the time till 5 years. So we are recommending another dose around 5 years to be sure. And one important thing, Dr. KK, I want to tell the people who are going for studies abroad. Now people, especially in America where they don't see chickenpox, they want the Indian child to be either have the chickenpox antibiotic which are protected or they should have vaccine. So adults also go abroad, especially in America and UK after taking 2 vaccines. 2 doses because adult doses are not available. Adult doses are not available. What we recommend, what is the dose available for the children? You take 2 doses abroad, 6 weeks apart, and you take it. Or you have a chickenpox antibiotic form that they are protective of the chickenpox. Either they want certification of this.
What about HPV?
HPV is the one of the latest vaccine, and 2 strains are available, and
2 and 4.
4 strains available. 2 companies are also. 2 companies sorry.
Marketed by
to market it by.
We have 2 and 4,
4.
and 9 which has come in the market in the US, not in India.
Yes.
I'm saying 2 companies are marketing that. I want
One
to
is
say that.
for 2 and one is for 4.
For 4.
One has 2 strains and another one has 4 strains.
The issues in that a parliament committee has been formed because there were a lot of complaints of side effect related to HPV, and the IMA will have to address that because they are the champion of public health and also the adverse event, and there were some issues raised. So IMA recommends that this vaccine should be taken because there are papers, there is evidence that it protects in adolescent after the age of 16. Though the companies will recommend that as soon as 10 years it should be taken because in India the sexual exposure is normally at marriage, but it can be in the schools, but normally not at 10 to 12 years. So it should be taken after the sexual the chances of sexual contact.
Before the first sexual contact.
Yes.
So average age of sexual contact in India is still at high. Maybe you can say till 16 or 15.
But at some time, people are recommending that it should be taken as soon as the period starts. So
Because they
After 10 years
Because,
10 years of age.
because you presume that person will become sexually active in the Western culture as soon as the menstruation of the puberty starts. But what he is trying to say in India, still it is not there. But here, yes, our stand can be instead of saying the age before the first sexual contact.
Yes.
So instead of talking about the age, message goes. If the girls, some advanced girls, the message would go is that I need to prepare myself for any premarital contacts. I need to have HPV vaccine.
Though in legal term now, which IMA has taken a lot of workshop, before 18 now, according to Indian law, that it is the sexual contact is taken as
16.
16 is taken as unnatural or a rape. So that is why I am saying, looking at the legal provisions, we should be very, very clear that say no to sex and take HPV, because that is a message for adolescent, for the HIV/AIDS also. That is the control. Say no in a school. We have to teach. Say no to sex, and then also. Because we moral thing should also go with the vaccine logic. So that will help us.
No, therefore I am saying say no to premarital sex.
Premarital.
Say no to premarital sex.
And early marriages.
And take HPV before the first sexual contact. With both. Both for married and unmarried.
Both.
The message goes even for married.
You are right, and in the countries where the population is less, where every death is counted of the cancer of uterus or ovaries or cervix, Even the males are recommended in New Zealand and Australia. So issues are many depending upon the need. In my country it is not routine because we do not have evidence much that males are affected by other things. Yes, females are affected. Now we are seeing the tests are available. It is because of the virology tests are available. But he is right. We should recommend first sexual contact or 16 years.
Okay, so we have typhoid, we have chickenpox, we have HPV, and any other vaccine.
Hepatitis B.
Hep B is universally now.
There
Yeah.
is meningococcal
Hepatitis A.
Hepatitis A we can
A.
do.
Meningococcal.
meningococcal and pneumococcal.
Yeah, I think the other question which was asked, I think we should finish hepatitis A because again
Hepatitis A, yes.
important is they are waterborne diseases. So waterborne diseases
Cleanliness.
have to cleanliness. Our personal hygiene has to be added, taught, hand washing we are saying. Swachh Bharat Abhiyan, availability of the water, hand washing along with hepatitis A. Because we start eating in India, used to eat late, now we start eating early. So again 1.5 years, 1.6 years, 1.5 saal pe we can start hepatitis A vaccine. Now there are 2 vaccines which are available. So one vaccine is I got 1 dose, the other vaccine has got 2 doses, 6 months, 6 months apart.
Live vaccine.
6 months apart, their 2 doses are there. Again, there are high titer of hepatitis A after these 2 doses, and in later on it protects us from that. Especially school-going child should take it. If you have not taken, does not mean that you have not taken in 1.5 to 2 years. You can take it later on. Whenever you take it, it's not protected. Because it is during the school time the child gets infected, you got a jaundice, and most common jaundice in India is still hepatitis A. Hepatitis, and cleanliness is important for that.
Dr. Gambhir,
1 dose or 2 doses? What is
Yeah,
it?
6 months apart. The kid. So the live vaccine, one single dose is.
So definitely I need to come out with a IMA immunization program. We have a IAP immunization program, we have government immunization program. Similarly, we must come out with a.
I think this will, I think a very great initiative, and IMA has more members, and the depth and the width we can reach in India, none other organization can touch.
And what about now meningococcal?
Now pneumococcal, because there was a question on the pneumococcal.
Pneumococcal, yes.
Now pneumococcal as a history, when IMA was representing in Entegi, and I was representing IMA, because pneumo was introduced in India, it was one of the costliest vaccine India has.
Yes.
3,000 plus. And
4,000,
that time,
4,000, yes.
that time the Nemo 7 was there. The pneumococcal is got multiple strains. So those 7 strains vaccine which was available was not relevant because protection rate was hardly 30 to 40%. Costing 3,000 3 vaccines. So 10,000 rupees to a patient without any much benefit. So we thought that India should have a better vaccine. And we recommended that no vaccine will be allowed to enter in India, and through the IMA Office of the Drug Controller General, that no vaccine will be licensed which has got less than 70% of the seroprevalence. So the serotype which are available in India, जो bacteria यहाँ पे है उन्हीं की vaccine होनी चाहिए. So Nemo 13 was introduced along with Nemo 10. Both of the vaccine, Nemo 10 and Nemo 13 had serotypes which were 70%. So these were introduced in the Indian market. These are available in the private. Government of India is thinking of adding this, and no country can take this costly vaccine. So what the Government of India is trying through the Department of Biotechnology is to talk with the manufacturer, help them, and we'll shortly, maybe till next year, we'll have an Indian pneumococcal vaccine, which will be produced by Serum Institute of India and also by the Bharat Biotech, and other companies are going into it. But very important point, which I request the IMA and Dr. K.K. Agarwal to his office, there is a serotyping shifting.
Yes.
That in UK it was saying that they have given pneumococcal vaccine, but the number of pneumonia admission in hospital have not reduced. Bacteria are smart. They are 200 million years senior to us in this community. They change their serotyping and they get resistant to that. So there has to be good post-marketing surveillance, which is not existing in India.
Yeah.
So giving partial immunization to few will cause more harm than benefited. So that is, I am for the IMA to make a policy, should these vaccines be allowed in India? If they should be allowed, they should be used by at least 10% of the herd. Otherwise, some of the vaccines will create more problem for us than solutions for us. IMA is the only body which can take a lead, because being a part of the professional body, we will only talk about the profession and academics. We don't talk about other part, implementation. and the practices. So we can change the practices, we can put pressure on the, do an advocate to the government and to the drug controller, where IMA is the part. So IMA can play a very major role in introduction of these new vaccines.
So as on today, Nemo 23, we don't give it in children.
No, wait. Now these are conjugate vaccine. These are vaccines. The problem with pneumococcal was these were polysaccharide vaccine, Nemo 23. But this does not have a memory cell. So children earlier than 2 years was not been getting benefited by Nemo 23. This pneumococcal is more in under 1 year. Pneumonia is more in under 1 year, especially under 6 months. So there was no use of Nemo 23 been given. Nemo 23 is only benefited after 2 years till 60 years or maybe in the adult. So that is why there was a need of conjugate vaccine. That is technique where the protein conjugate was done, and that is why 2 conjugate vaccine, Nemo 10 and Nemo 13 has been introduced.
So in India, we are using both.
India will just go after 2 years, you can use
23, otherwise we are using. In adults now we are talking about both.
In India, yeah, adult we are talking
We are
about.
talking about 13 and 23 with a gap of 1 year.
One.
It was earlier 6 months, now it has become 1 year.
Right.
Yes.
And in immunocompromised, the gap is in weeks.
Yes, we have to also educate. Initially, we are only talking about vaccine in children, but you are right, adults, especially going for the heart diseases, for the respiratory diseases, it is very much required. And especially with the scare of the swine flu, it was seen it was a pneumococcal. They don't die of the swine flu, they die of the pneumococcal because they are resistant. So it has to be co-protected from that. So the comorbidity has to be there.
Just to enumerate that you are seeing this live webcast on a weekly basis on our IMA website, and you can go on the front page of IMA. You can see it live. You are also seeing it on emedinaccess.com, where you can interact with the people. And this is being brought to you by Digital IMA, a IMA Librate initiative. Remember, IMA has tied up with Librate as our digital partner, and IMA has come out with a policy that doctors for their patients who are their established patients can consult online. You can open your clinic, say for example, librate.com/drkkagarwal. You can open your clinic, and in that clinic, you may pre-charge the patient for your established relationship. This policy of IMA to allow doctors, because every time we get a complaint, the patient tells us that we are allowed to charge morning and evening in a hospital inpatient. Why we are not allowed to charge morning and evening in an outpatient setting? In a hospital setting, if the patient is admitted for 3 days, you charge for 6 visits, morning, evening for 3 days. But in a private setup, when you see the patient now, next day when the patient comes, he refuses to pay. To take out that answer, the only answer then is a digital initiative for patients who want to show your results and they want to save their time, specifically if they're coming for outstations. So we'll continue with our discussion, please.
Dr. Gambhir, there's a lot of talk about influenza, flu, or H1N1 vaccine. Your take on that? What is your advice?
Before that question was which is better, Nemo 10 or Nemo 13? As far the Indian data are concerned, both are equally effective. One could be cost effective. Some countries have preferred Nemo 13 over Nemo 10 depending upon their strains and the serotyping they have. So in India we can use both equally well. Now on the influenza vaccine.
Saying on the pneumococcal, I mean for the diabetics, those who are having a lot of problem, uncontrolled diabetes, pneumococcal should be tried. Because most of the time I am seeing people are advising pneumococcal vaccination.
In adult, yes.
Yes,
It's a must.
Yes.
Absolutely, it's a must. Now we are recommending every 5 years vaccine, and at the age of 60 or 65, once for life. We are giving Nemo 13 and 23 with a gap of 1 year. If you have received 23 in the back, you can give a gap of 1 year and give Nemo 13 alone. Flu vaccine has to be given once in a year. And today the new studies are talking about that flu vaccine reduces cardiac mortality, heart attack, stroke, and now latest atrial fibrillation in patients with diabetes. Because now the new epidemic of the society is air. Now they say if you give a flu vaccine, that means flu precipitates air in a patient with diabetes.
The question, Dr. Moga, you were asking about the influenza. Now, influenza created havoc in many ways. So, what WHO thought was to get a data. So, they made a 10 sentinel center through the ICMR to collect a data ki which strains are there. Influenza is a virus which changes every 6 months to 1 year, you can say. So, there were two, the hemisphere were divided into northern and southern hemisphere.
Northern and southern.
And India was, though we are in the northern hemisphere, because in mid-season we used to get sometimes the southern strains also. So through the strain, through the sentinel centers, we come to know which strains are available in India. And according to the data given to WHO, which is given to the company, the flu vaccine comes. So that is why, as Dr. KK told, flu vaccine has to be taken every year. It has to be taken every year because it is the changing virology and the structures of the strains. Now, swine flu is one of the flu vaccines, which got mutant and which got change and which got lethal. It is a debate, not a debate that it will be a long answer that more so over in the immunocompromised adaptive.
You have teeth, you have backward. One of them will become a terrorist.
Yes.
So, couple of questions. For individual protection, now, before we go back to this polio vaccine, quickly polio switch. IMA polio switch strategy.
Polio
It's
switch.
been switched now because we are from trivalent, we are going to
We have
become.
talked about
But
that.
bivalent, we stand with the nationalist positive because 26 million babies have to be given, so 1 billion doses have to be given, so we go with the national policies of switch of the bivalent vaccine is minimum one dose of injectable. But
Injectable.
oral has to be taken. The message is, I think if you take
Doses
one
of-
program,
yes.
oral should not be stopped because some companies and some professional bodies are suggesting you can take injectable and stop the oral. No, oral should not be stopped. Add on
In
injectable.
addition to one double suraksha, that's what the government program is. One IPV extra plus it shifts from
Yes,
trivalent to
Trivalent
bivalent.
to bivalent.
On the day, April?
April.
1st April.
No, not first.
23rd April.
24th of April.
मैंने letter भिजवाया था.
He says for individual protection, IPV is sufficient. For population prophylaxis, OPV is necessary.
So we are talking about population because
Which rotavirus vaccine out of available brand is recommended? I mean, then the third is giving conjugate pneumococcal vaccine is essential as routine immunization.
It is not-
If patient can afford, yes, at any age, we should be able to.
if you have not taken till 6 months, if there are no issues, so be clear that there are less chances of getting it. So that is the epidemiology and science. The science says that you need not worry if you have not taken till 6
A
months.
couple of more in between, we have a health break, and our break is that we also have a tied up with the pharmacovigilance program, and government is, IMA is now becoming a nodal center of pharmacovigilance, and we will also be sending you a lots of IPV related information, and healthcare professionals are advised to watch monoparesis due to the use of ticagrelor. And that's something for cardiologists to remember that ticagrelor can cause monoparesis. That's a new DCGI alert which has come. And then another yes, only one has come from this. One more question has come from Dr. Vijay Singh, and he says, please throw light on vaccines for health professionals. Charity begins at home. Whatever we are recommending, if you are not going to give it to yourself or to your family members, you will never be able to give it to your patients. Charity begins at home. Whatever we are talking about, if you are convinced, take vaccines, give it to your family members first, then give it to your patients. Carry on.
There are two things more. JE vaccine and cholera vaccine.
Very important, but question is not, I think your JE vaccine is very, very important. I'll tell you why. Because what KK is saying about health professionals is more of the adults, so he could be the right person. But I think as a health professional, the doctors and nurses should be protected. And now the meningococcal vaccines are also available, which we do not give to the hotline.
The stand which IMA needs to take is only one. Who pays for it?
Yes.
IMA feels that it is a duty of the employer to give protection to its employer. That's what IMA feels like is. We can make it as an issue, we can fight for it. The employer has to look after the interests of the employees. Whether it is a nurse, whether it is a ward boy, whether it is a chowkidar, they need to be given protection. And therefore we need a policy of a bulk rate. Therefore we need a bulk rate with a tender. So that more, at the moment I am afraid that 5,000 rupees I am not going to put it on my chowkidar. But then if the vaccines are available at a cheap cost,
500 rupees.
suppose all vaccines are available at 1,000 rupees, fine, instead of giving them a bonus, give them all the vaccines.
Yes.
That's the way I look at it. Quickly, we have very short of time, Japanese encephalitis in cholera.
Cholera is vaccine is made and tried in India, but there are some pocket of cholera which is still available. It is more often is taken as a traveler vaccines by the foreigner who are moving, and in the area if you are entering a cholera epidemic area. So those vaccines should be taken.
So
It is available.
at the moment we don't.
It is, yes.
What Japanese encephalitis?
Japanese encephalitis. Now it is in the national program. So it is in the national
All over the
program.
country or?
No.
No, it is in the selective district where there is a high incidence is there. There are North India, there are area of the UP, there are area of the other areas. And these Japanese vaccines, initially we used to get it imported from the China and give it. Now it is made in India, is also there. It is made by BE in Hyderabad. And a lot of stuff, because they are so epidemic, and you will really find clinical cases, and where from the MRI or from the CSF you can confirm that it's a Japanese encephalitis. It is to be given to the adults and to the children, the both. So high incidence has been found in some of the areas, and this is the vaccine is also taken by a lot of travelers who are traveling. It is also recommended the health worker again who are going to work in that area, and the doctor should get it.
Is there any thing like vaccines in other countries?
Now, lot of new vaccine is for preventions. Now, lot of new vaccine, oral vaccines are coming in.
I'm talking about other pathies.
Other
No,
pathies like
homeopathy,
Ayurveda.
homeopathic vaccine, Ayurvedic vaccine.
No.
I'm talking
Till
about,
date we have not
are there
heard.
any studies available that
We have not heard.
The lead of
so
the
what I'm trying to say is, I personally am not against if somebody takes a homeopathic vaccine, if
Yes.
there is one available.
I'm also
But then
against.
do not ignore the allopathic vaccine.
Yes.
Let him take it in addition.
And there are a lot of good vaccines, though they are not pure vaccines. It started with the veterinary. If you say the cowpox history of the genre, it started with veterinary, and those people are using a lot of vaccines and a lot of good quality vaccines. But a lot of being produced in India. Some of those companies have switched to the other vaccines, some of the government agencies, so they had a problem of the safety. So definitely we can get a lot of information on veterinary vaccines, but they are not to be used combined. Yeah, and those.
I was attending the conference of the Ministry of Health on antibiotics today, and somebody from Japan was talking about they have introduced the concept of giving a vaccine to the fish, so that the fish doesn't get infection, and so that when you eat that fish, you don't get infection. So they are talking about vaccinating the fishes which you are cultivating for the purpose of eating. I mean, the people have gone to that extent. This is instead of giving them antibiotics, like in use of antibiotic in animal husbandry, they are talking about the vaccine should be given to
You'll
them.
have to take fish now. Come on.
And to the doctors,
In India,
Japanese fish.
Japanese fish.
No,
In
but
India, a river fish and sea fish, it is
No, no.
very
We're talking
difficult.
about poultry, where people cultivate.
I think the message which the IMA should his headquarters give to that because in private if you are giving vaccine that patient comes back to you. One is the adverse event, if you can have the
I was
data.
talking about it.
And if you can have a data which is not available in the country, and if he gets the same disease, I have seen a lot of people who has got rotavirus back.
Yes.
So it is a sort of a post-marketing surveillance which company is not keeping, but doctor can keep for his patient. If you add that data to the national pool through the IMA, I think that will be wonderful data for us, and we can take. Recently there have been cases, and we have complaints in the Delhi Medical Council. A couple died after getting anti-rabies vaccines in a government hospital. One death has been reported after, say, rota. They go to us for investigation and causal investigation. But a private doctor can also see if you have given pneumococcal and a child gets pneumococcal again, so there was something wrong either in delivery, storage, or in the vaccine. So we have to also see.
Cold chain
The
maintenance is very
other
important.
message is cold chain.
Cold chain maintenance is
It
very
should be
Cold chain maintenance is very
exclusive cold chain. I think we should put on the website. Exclusive cold chain fridge should be kept in a private. It should not be used for any other purpose. And we should store in a proper way, because if vaccine is not stored in a proper way, it is not going to take any.
No, the vaccine should not be
So there are
kept in the
two-
door of the
Don't
fridge.
forget two anti-cancer vaccines. We have a hepatitis B which prevents liver cancer, and we have HPV vaccine
HPV
which
vaccine.
prevents anal cancer and cervical cancer. So remember that we also have cancer and the best.
Here I'd like to add one more thing. Is BCG is preventing bladder tumors, bladder cancers?
It is
BCG now is a part and parcel of treatment.
Treatment. It is a part of it.
But what I have read in BCG vaccination,
yes,
that
yes.
smallpox as well as bladder cancer is being protected.
Yes, protected in the sense that BCG is one of the only vaccines. The other vaccine which I forgot, I'll come back, is the only vaccine in newborn which is given intradermally. When you give intradermally, it is to stimulate mitochondria and the mast cells, so it produces lot of immunity. So this benefit has been taken in the adult during the immunotherapy of the bladder cancer. One important vaccine which we forget is the anti-rabies vaccine. India has got maximum number of deaths because of the dog bite, and I think IMA, I will request Dr. Teke whether we file a BIL or we have a system of the dog, because if the dogs are not immunized, the human bites, the dog bites are maximum in India, and government of Delhi is giving all the vaccine free of cost with serum also, because the treatment protocols have changed. It is costly for some of the patient to take the serum, and it is not available, and it is not safe to get serum all the time for all the
only
uh,
2 or 3 places in the city.
So this message is whenever a dog bites, immediately the patient should get the vaccine, and there should be observation of dog, and if the grade is more than 1, then only thing you should also go for serum. Prevention like wash of the wound, hand washing again should be done, because that is very, very vaccine, and this is most the maximum people die of rabies in India, and we are not talking about rabies because it is not an international disease. So this is the disease of India where we should highlight, and IMA can only play the role because no professional body, let it be adult or pediatrics, takes it very, very seriously.
But do you advocate prophylaxis against rabies by giving injections to human beings?
Yes, you take it.
So
Any dog owner should have a prophylactic vaccine. Every dog owner is more at risk of dog bite, so they should have
3 doses.
So every
No,
dog
7 and
owner,
21.
every dog owner should take a anti-rabies vaccine, and even if you are a dog handler or if you have your neighbor's dog, I don't mind having prescribing them anti-rabies vaccine. So we have gone through a lot of discussion today, and hopefully we will come out in the next 1 or 2 weeks a couple of standing committees or advisory committees in IMA to take up these issues and come out with IMA policy in each and every vaccine. Because our IMA members are always confused, and people are always being blamed that doctors are making money, therefore they are giving vaccines, and so therefore we need to have a IMA policy which clearly defines so that my members are protected. Today in the health ministry meeting, the health secretary, the joint secretary, the additional secretary, everybody was there, and people were talking about rational use of antibiotics, and everybody was talking about guidelines for rational use of antibiotics. And I stood up and said, IMA is not bothered about antibiotic protocols. We only want to come out with a policy in the next 3 months when not to write antibiotics. Instead of when to write, come out with a book when not to write antibiotics, so that my member is protected. If he is not writing antibiotic, nobody goes to the court of law. He can quote, IMA website talks about when not to use antibiotics. Remember that there is no law case, no lawsuit for writing an antibiotic. There is always a lawsuit that you have not given antibiotic in time, therefore the person has gone into sepsis. Therefore we need to come out with such types of guidelines. Similarly, these types of vaccines, IMA will come out with this paper in the next 3 months, and it will be on our website. It will basically talk about, for those who can afford, these are the vaccines, and IMA will also go and float a global tender to find out if our members can get a cheaper vaccine. And remember, charity begins at home. Charity begins at home. If you smoke, you will never tell your patients not to smoke. Therefore, unless you get convinced, you give adult vaccination to your parents, you take adult vaccination yourself, and you make sure your children and grandchildren are totally protected from all types of vaccine, then only the message will go to the community. And that's all for today. We thank Dr. Ajay Gambhir, and who is also the president of NNF, National Neonatology Forum. We also have another pediatrician who happens to be the joint secretary also of our Indian headquarters. With me is Dr. V.K. Monga, the Dean of IMA CGP, and our Finance Secretary, Dr. Tandon. we say goodbye to you. We'll come back next week again with another topic. And till that, goodbye. We thank both Immunization and Laborate for associating with us. Thank you.
थैंक यू। वहाँ शुरू किया था, आज मैं इंटरटर्म में भेज देते हैं ना, डोज कम होती है ना,
हाँ, हाँ।
तो ये आज